Hi, my name is Laniya Love. I am a postpartum nurse here in Tarrant County. Sorry, I should start by I'm specifically doing my proposal in Tarrant County because that is where I work and where I live. But this proposal that I have, hopefully, I'm hoping it spreads nationally. Of course, we're going to start small, but we're going to take bigger steps and try to make it more wide scale. So, my proposal is going to be focused on reducing negative patient outcomes for mothers and infants of color here in Tarrant County hospitals. I have a very high passion for this subject just because I tend to see it a lot, not only in Tarrant County but across the U.S. Women of color tend to have more healthcare disparities when it comes to during pregnancy, after pregnancy, in terms of like complications with the mom, with the baby. We just tend to see higher rates for women of color, and there are things we can do as healthcare professionals to prevent that from not only increasing but from that unequal care from being provided. So first, we're going to talk about the objectives and goals of this presentation. So we're going to describe racial and ethnic disparities in maternal and infant outcomes nationally and in Tarrant County. We're going to explain the rationale and purpose for focusing on this subject. We're going to prevent evidence-based interventions to improve postpartum outcomes. We're going to talk about the implementation of this, the evaluation measures, and the destination plan for this project. And then we're going to highlight the role of the postpartum nurse when it comes to promoting equitable care. Like I said earlier, the entire health care team is going to be responsible for making sure that this proposal plan actually not only works but is implemented in general. But postpartum nurses, since I am one, that's kind of going to be the focus. Our role in making sure that we advocate for our patients and really implement these measures and make sure that staff is continually being trained to provide culturally competent care to postpartum moms. So first, we're going to talk about maternal health disparities in the U.S. and in Texas. So in the U.S., Black women experience pregnancy-related deaths at about 2.5 to 3 times more than white women. And this is statistics straight from CDC. Unfortunately, there are stark racial gaps when it comes to maternal deaths and severe complications. And even when you account socioeconomic factors like income, education, there are still very stark differences. And that really shows that there's things that we need to change, that we are not doing anything to change. Because even though we have reduced our numbers throughout the years when it comes to maternal mortality rates, they are still high. And for women of color, they are still higher than very much higher than their white counterparts, which shows. And this kind of highlights, the underlying racism, differential treatment that women of color are provided, and gaps in postpartum follow-up care. Many of the deaths that women of color tend to face, including Hispanic, Native American, Asians, African American women, these deaths are most of the time avoidable, preventable, if they were just given timely, high quality care. Texas data similarly shows that higher severe maternal morbidity and mortality exists among Black women specifically. So we're going to kind of look at some of those statistics and graphs that really highlight the difference in how likely a maternal, sorry, how more likely a Black woman is more to die during childbirth as compared to other races. So this graph on the left is showing the maternal mortality rates in Texas from the years of 2019 to 2022. And as you can see, for Black women, their rates are significantly higher than Hispanics and whites. They have decreased over time, but there's still such a difference between them that we need to do something about it so that we can provide more equal care for everyone. Of course, negative outcomes in general some of them are unavoidable, but when there's such a difference in how certain communities are being affected, that's how we know that there's a problem underlying, in healthcare, in the system that we have to address. The table on the right is for the nation, so United States, the maternal mortality rate by race and Hispanic origin. So as we can see, non-Hispanic Black women are more susceptible to dying during birth. This is for the years of 2021 to 2022. And then Hispanic is next in line, and then white women, Asian women. So specifically in Tarrant County, we see higher maternal complications and readmissions among women of color. Black infant mortality the rates are nearly double the county average in many recent reports. And this is, again, caused by certain social determinants such as the neighborhood moms live in, access to care, insurance, transportation, chronic stress. The table on the right, it shows the maternal mortality rate by race and ethnicity in Tarrant County from the years of 2024 to 2023. And as we can see, the non-Hispanic Black women are very much more likely to pass away during birth. And there is a healthy people goal. The 2030 objective is to reduce maternal deaths to 15.7 maternal deaths per 100,000 births. We are getting there, but we are not there yet. As you can see, obviously, we're in 2025. We're waiting for more statistics to be, settled on, but as we can see, we are not at the level we want to be, so there are changes to be made. And then the table on the right shows infant mortality among Tarrant County residents from 2013 to 2022. So this green line up here is going to be the mortality rates for non-Hispanic Black women. And as you can see, over the past decade, they've been significantly higher than every other race. Tarrant County in general has improved as time went on, but like I said earlier, there's still things we need to address to make sure that we're providing equitable care to every race, every ethnicity. This table is just showing the comparison of maternal mortality rates throughout different Texas counties. So we have Tarrant County here, which is the one I'm specifically focusing on because I work in Tarrant County. But when compared to other counties, you can see that we're not kind of on the higher end when it comes to a lot of the other Texas counties. But the goal is for this intervention to start in Tarrant County and then spread to different counties in Texas so that we can reduce these numbers, because even these numbers are enough to spark a change throughout the state and then eventually the country. So my problem statement and Pico's question. So the problem is that postpartum women of color in Tarrant County experience higher rates of preventable complications and negative infant outcomes. The population is women of color who are postpartum in Tarrant County hospitals. The intervention is to provide culturally competent postpartum education and implicit bias awareness training for staff. Comparison, we're going to compare to usual postpartum discharge teaching without structured equity focused strategies. And then we are going to, the expected outcome is going to be to reduce preventable maternal complications and improved infant outcomes. So the background and significance of this. So a lot of these disparities that women of color face are due to structural racism, chronic stress, and differential treatment. These experiences of discrimination are linked with preterm births and low birth rates, both of which can be deadly for babies, and birth defects in general. And then as we talked about those social determinants, so housing, income, neighborhood, insurance status, these all exacerbate risk for women of color. They're more predisposed to the effects of these things, and those can lead to negative outcomes. And the postpartum period in general is very high risk when it comes to internal bleeding, infection, but it tends to kind of be under-resourced, especially with women of color. Their postpartum period isn't as taken as seriously by healthcare providers as white women, and that is something that we need to change and highlight. A lot of people might not be aware of it, and making them aware is going to make sure that these numbers reduce. So why should we address these disparities? We should address them because we want to reduce the preventable complications among mothers and infants of color. We want to make sure that everyone is having a good outcome. After they give birth to their baby, it's supposed to be a happy time, a good time. We want to make sure that they're safe and providing culturally competent education and bias-aware practice. Unfortunately, families of color, they face disproportionate postpartum complications and grief. We want to reduce those. There are gaps identified in discharge teaching, follow-up, and cultural relevance of education. And implicit bias can negatively influence communication, pain management, and responses to systems. So one case I wanted to focus on is the death of Dr. Shanice Wallace in 2020. This is a real woman who lost her life, unfortunately. She was 30 years old. This was in Austin, Texas. She was a chief resident. She developed severe preeclampsia late in pregnancy, and she delivered her daughter at 34 weeks during the emergency C-section. She had deteriorating blood pressure and signs of organ damage. She developed HELLP syndrome, which is hemolysis, elevated liver enzymes and low platelets, severe liver rupture, kidney failure, and internal bleeding. So her death, I jumped the gun. She died 48 hours postpartum. Her death kind of exemplified how there's delays in escalation of care when it comes to women of color, underestimation of symptoms. Sometimes when women of color say that they feel, lightheaded or in extreme pain, due to structural racism, their symptoms tend to be overlooked and kind of undermined. And then the lack of timely recognition and intervention when it comes to that patient chain of status is also why Black women tend to be more susceptible to those negative outcomes. And then Black women in general are just more vulnerable to the maternal health crisis. And we need to address the systemic failures, including disparities in how symptoms are taken seriously, the unequal pain management and delayed treatment. So literature reviews, clinical outcomes. So Peterson and CDC found that a majority of pregnancy-related deaths are preventable, and Black women are at the highest risk when it comes to all races. Adogoki et al. Found that higher rates of hypertensive disorders and severe maternal mortality and morbidity among Black women as compared to white women. And then we need systemic interventions rather than just blaming, the outcomes on individual patients. Literature says that we should provide trauma-informed, culturally tailored perinatal programs to reduce admissions and improve patient trust. Community engaged models involving doulas and peer support improve breastfeeding satisfaction among women of color, and the implicit bias and equity training can reduce disparities in communication and pain management. So the proposal plan that I created is a culturally competent postpartum education bundle. So basically the components are a standardized script, a teaching script, multilingual written materials, and then a QR code for videos. Technology is at the forefront of everything nowadays, so that would be a perfect way for a mom to scan the QR code and have these educational videos of what to expect postpartum, what's normal, what's not normal, what to look out for, what to call the doctor for, that type of thing. And then in this plan, we're also going to provide implicit bias and culturally community training for postpartum nurses and providers, and we're going to integrate referrals to community resources such as Healthy Start, WIC, local support groups, and we're going to implement on postpartum units in Tarrant County hospitals serving diverse populations. So the stakeholders, when it comes to this proposal, are going to be patients, OBGYNs, postpartum nurses, and community doulas. So when it comes to the patients, after this is implemented, they're going to have improved safety. They're going to have improved trust in healthcare providers, and they're going to have improved health literacy. So kind of what I was saying about teaching them what to expect when they go home, what happens normally for the postpartum period. They'll be more informed and more aware of, oh, this is not my normal. Let me call the doctor and get help for this. And that will help prevent those complications from happening. And then when it comes to nurses, of course, having increased cultural confidence and having clearer protocols will help us provide safer care and more timely care, so we can address those adverse outcomes before they get too severe. And then when it comes to the impact, so we can see like hospital administration will have reduced readmission rates, reduced adverse events happening, and then we can reduce costs as well, because mothers are facing fewer complications that were preventable, so they're no longer needing to stay longer or anything like that. Same goes with the babies. So the timeline, we're going to have the phase 1 is going to be like the training. So it's going to be training for all of the staff, focusing on the implicit bias and cultural competency. And then education is going to be like for like developing like multilingual educational materials that address specific maternal health concerns within the community, especially making sure we have a Spanish one because there is a huge Spanish speaking population here in Texas. Phase 3 is going to be to establish community partnerships with local organizations to enhance trust and support for mothers and infants. And then phase 4 is going to be integrating these findings into best practices into quality improvement initiatives to ensure sustainability of this program. So some of the education components of this proposal are going to be warning signs to look out for in the postpartum period for moms. So like hypertension, hemorrhage, infection, depression, having safe sleep, making sure they follow safe sleep practices for their children so that we avoid SIDS or anything like that. And we're going to provide like, visuals, handouts, plain language handouts, not using like a lot of medical jargon so that patients are able to understand what we're saying. And then those QR codes or having teach back, kind of telling them, hey, look out for this and this and this. And then be like, hey, so what symptoms would you have that will make you call the doctor, to make sure that they can recognize whenever they have a change of status, whether they're still in the hospital or out of the hospital, and they were able to address those problems before they get too severe. And then we want to have unit champions and annual competency refreshers. So having someone who's specifically trained on these situations so that we can reduce these outcomes at our facilities. So we're going to evaluate the project outcomes and effectiveness by looking at the postpartum readmission rates, the ED visits, the high blood pressure related complications, infant ED visits and readmissions. We're going to do patient satisfaction surveys with specific questions on respect, understanding, and trust that they had in their healthcare team. And then before that we implement this, we're going to do brief staff surveys on bias awareness and self-rated cultural confidence. And then after we implement this, we're going to give that same survey again to see if there's like an improvement. And then we're going to do patient comprehension checks, which is kind of like that teach back I was talking about. We're going to collect this data for over 6 to 12 months, and we're going to compare it with baseline after the 12 months to see if there's any improvement, if we need to tweak the intervention at all to see improvement, that type of thing. So expected outcomes. So we expect to see a reduction in postpartum readmissions when it comes to women of color, improved patient-reported understanding of discharge instructions, and enhanced staff confidence when it comes to providing culturally competent care. So I plan on presenting these findings to hospital quality councils and postpartum unit leadership at my facility. It is also possible to share these results at professional venues, such as the HWHONN chapter meetings, local nursing conferences. And then we also want to make sure that we develop a continuing education session for this, so that we sometimes, as healthcare providers, we get so like busy and caught up in the everyday things that we like forget, the training that we did, because they're like usually just like really short videos. But if we require them to be annual, it'll kind of keep that on the mind, refreshed, and make sure that everyone is continually providing culturally competent care to every mom. And then when it comes to refining the intervention and making sure that everything is contributing to the improvement of, maternal outcomes, I had a discussion with Anita Doyle, who is the nurse manager on my at my facility for postpartum labor and delivery. She is certified in maternal newborn nursing, neonatal nursing. So she has seen many women of color be disproportionately affected by negative outcomes solely because of the color of their skin. And we discussed that after we implement this, we'll be able to present to women's councils and potentially publish findings in relevant journals to reach a broader audience of healthcare professionals. So to summarize this proposal, inequitable outcomes for mothers and infants of color are not acceptable, and they must be addressed intentionally. We must enforce culturally grounded education and staff bias awareness training so that we can reduce these numbers and enhance trust, catch early warning signs of a change of patient status, and to empower families to feel safe when they are discharged or when they're still in the hospital. We want to make sure that they have enough trust in us to report any crazy symptoms, feeling of doom, that type of thing. Is my baby okay? That type of thing. Making sure that we provide equitable care to every mom and baby, to make sure that they're safe and they are able to go home safely and live happy lives. So I wanted to thank you guys for listening to my proposal. If you guys have any questions for me, please leave them in the comments. Thank you. Here are my references.